I had throat cancer. Yeah. So I had throat cancer now 28 years ago, but even then my voice goes up and down a little bit. So you just bear with me and forgive me. There are people starting to introduce themselves on the chat, so I don't need to say that now. So thanks very much for doing that. That's brilliant. So I can see Catherine Stanley, Lynn Laidlaw's here, Matt Westmore's here, Nat Date. So this is fabulous. So thank you very much for joining us. I take it you've got an interest in transparency. I take it you've got an interest in health research. So this is a workshop. It's a workshop mode rather than conference mode. You will make it work more than me. So please use chat, use the discussion groups, and have a good old blether with people. Yesterday, we launched the report. So I don't know if that can, oh no, I have to put it in front of my face. There you go. And we had Lucy Chappell talking, head of NIHR. But more important, we had Amanda Wellings talking about and giving a poem, Norm the Pigeon. I'll be putting the link into that in the chat. Don't read it today, don't listen to it today, but when this is finished, then please do so. So I'm a patient advocate, co-chair of Make It Public campaign group with Matt Westmore, who's chief executive of the Health Research Authority. Now I'm just going to turn my page here. So I've got a few things to say. So I think, Cynthia, could you just move the slide, I think? Thank you very much. So we're recording today, but only the big sessions. The breakouts, we will record, but we'll record those for the facilitators to make notes. The only recordings that will be made public will be these open sessions. We'd like this to be as accessible as possible, although given it's online, that is challenges. If there's any difficulties, please contact one of the team or Will directly and just say, I'm struggling with X. We hope it's inclusive, safe, and useful. If there's anything you feel is not one of those, please just send a note to everyone or send it direct to me. Because if I've made a mistake, I would rather be challenged and spoken to rather than spoken about afterwards. We'll be using Zoom chat, and then I would just ask you get involved with the conversation. So next slide, please. So Matt, I'm going to pass over to you. You're going to set the context, and then it comes back to me.
Thanks very much, Derek, and thank you everyone for joining us this afternoon. As Derek says, my name is Matt Westmore. I've got the joint privilege of being Chief Exec of the Health Research Authority, but more importantly for this conversation, I co-chair with Derek something called the Make It Public Campaign Group, and it's the Make It Public Campaign Group which brings together many organisations, individuals, and members of the public together to try to move us forward around the areas of research transparency. So big thank you to them for all of their kind of support putting this whole week on. And then finally, a big thank you to, whilst it's a complete partnership across the campaign group, my team at the Health Research Authority, many of whom are on the call today to help make things go well. I'm sure you all understand the huge amount of work, dedication, commitment, blood, sweat, and sometimes tears will, I think, maybe go into arranging these sorts of things. So big thank you on your behalf, if you'll allow me to be so bold, to them. I've been asked to talk about why is feeding back to participants important, which is kind of an easy task, because I wouldn't be here if I didn't think it was important and didn't understand why, and I'm sure you wouldn't either. This is a sort of self-selecting group of people that are committed and are passionate about this topic, but I think there's some important points for us to explore. I wanted to start by asking a question, really, in have you ever participated in a research study? And if you have, I want you to sort of think back to that experience. If you haven't, try to put yourself in the shoes or the mind, the emotions, the feelings of someone that does participate in a research study. And close your eyes and think about that experience. And that if your only interaction with the research team, lovely people though I'm sure they were, if your only interaction with them was for them to ask you to do something for them, give up your time, your data, maybe have quite an uncomfortable and invasive procedure in order to give them, the research team, something. If that was the only interaction you ever had with them, would you feel that your contribution was either valued or valuable? Would you be likely to do that extra thing they're now asking you to do? Would you be likely to sign up to another study in the future? I would argue that for many participants, the answer to those questions would be no, we wouldn't do that. We wouldn't find that a meaningful and worthwhile experience. We'll be less likely to want to do it again. We know that unfortunately that is the case for the vast majority of studies that happen in the UK. Therefore, that is the experience of the vast majority of people that get involved in research. But I do want to start on a more positive note, and that's that since the launch of the Make It Public strategy in 2020, the research community, that's all of you, all of us together, have been working really hard to improve research transparency and make it the norm. More than ever, research transparency is seen as the key to a thriving health and social care research environment, and more than ever, a thriving health and social care research environment is seen as the keystone to many of the things we want to change and achieve about society, whether that's improved health or social care, all the way through to improving our economy through inward investment. And the UK is seen as a world leader in research transparency because of all of the work that you've done. So we've got a lot that we should be proud of. But of course, we've still got a lot of work to do. Hence, we're here today to talk about feeding back to participants. It is still not the norm to either have ongoing communications with participants during a study or to feed back the findings of that study at the end when it's completed. In the report that Derek referred to, only 29% of studies who submitted a final report to us told us that they had actually fed back the results at the end of the study. It's a guess, but my guess is even fewer of those would have kept participants informed throughout the study or done so in accessible ways. So why does that matter? Surely it doesn't matter. All that really matters is that research is published in perhaps leading journals, that it's picked up by the systematic reviewers who can kind of figure out how to set that in the context of other research and is appraised by NICE and ultimately changes practice. Surely that's the only thing that matters. Now, of course, I'm being rhetorical here. I wouldn't be here today. You wouldn't be here if we thought that is all that mattered. It really is important that participants are fed back to. The first reason is it's just the right thing to do. It's a pure and simple matter of respect. It's a matter of respect for the people who make our work possible. And it's a respect for the partnership that work should be. And if we don't respect either the individuals or the nature of that partnership working, then we are not delivering on our kind of ethical and moral responsibilities. But even if we set aside that ethical argument, there's of course a utilitarian argument in that better ongoing communication with participants makes research easier and better in the end. When researchers work with patients and the public to plan studies from the outset, we know that it makes recruitment easier, that participants are better supported throughout the study, findings are more relevant to patient needs. Ongoing communications with patients and participants throughout a study offer more opportunities for improvements. It strengthens relationships and provides opportunities for further feedback, which can further improve and inform not just the study at hand, but the reporting and the use of those findings. Feeding back can have several other benefits. It can help participants understand the purpose and impact of the research in which they are participating, increase their satisfaction with the research experience, foster a sense of reciprocity, demonstrates that researchers value and respect the input of participants and that their contribution is making a meaningful difference to advancing knowledge. Feedback can have wider societal benefits as well. By providing participants with information on the findings of research, they can share those results within their communities, increasing awareness of health issues, promoting evidence-based decision-making. That not just helps those communities, but helps all of us that work in research, because it's fundamental to increasing, maintaining public's trust in research and promoting participation in future studies. So the question for us today, obviously, is not whether it's important and whether it should happen, but why isn't it happening more often at the moment, and how can we make it easier to do? We at the HRA just yesterday, I think, published some new guidance for researchers, funders, sponsors, anyone that's involved in sharing findings with participants. That guidance is focused on reporting the findings, so it's just part of the conversation we're going to have today, but it does cover in more detail some of these reasons why it's important to communicate, why it's important to plan early and critically to ensure that there are the right resources to do it well. Feedback to research participants can take various forms, of course, and be provided in a myriad of creative ways. And Derek mentioned Amanda's amazing poem yesterday that she wrote and presented on the importance of research transparency through the voice of Norm, the research transparency pigeon. So there is huge scope and in fact need for creativity to feedback in ways that is engaging, is inspiring, is interesting, and of course is appropriate to the communities we're communicating to, the study design, and is presented in clear and understandable formats. And these are all difficult and challenging issues, but I'm really excited, as I know the rest of the team are, to spend the next couple of hours with you all to share your examples of where you have done that, because we know that whilst the number might only be 29% of studies who have done this, within that 29% are some really interesting and exciting and inspiring approaches to communicating with participants, the sorts of things which we know that you're involved with. If we can share that, if we can share how we've addressed those challenges that seem unsurmountable to some, then hopefully not only are we going to have a really interesting next couple of hours, but by next year we can see if we can get that 29% up to a level that we can all be proud of. Thank you. Oh, and you can open your eyes again now if you want.
Thanks very much, Matt. Okay, so we're now going to go across to a panel, three panels or three groups of people who have got some really good practice in this area. We'll hear from each of them.
Derek, sorry to interrupt you. Before we move on, there is someone with their hand up. Let's just see who's that.
Hi, I'm Leslie Dowling. Can you hear me?
Yes,
we can hear you.
I just wondered if you had been advancing slides. That's all, but I guess you haven't, since nobody else said anything.
No, apologies. I should have explained. I do this every time. I tend to talk about slides, so
that's fine.
No, none have been advanced, but they will.
Thanks.
Do now.
I've just been on web meetings where somebody kept talking and they thought their slides were advancing and they weren't. But yeah, okay, thanks. Bye.
Thank you for raising it.
No, hopefully this will work, right? Because I'm not in control of slides either. So we're going on to three groups. We've got Dr. Feifei Bu and Dr. Alexandra Burton for the UCL COVID-19 study. So we'll start with them, and hopefully they're ready and available to run their slides, or at least give their presentation. So can I pass over to you?
Yeah, sure. Thank you for having us. Let me just kind of start by giving you an idea of what is the COVID-19 social study. The COVID-19 social study is a large study of people's psychological and social experience during the pandemic. So it has two components, including online surveys and qualitative interviews. The study was launched in March 2020. Participants were followed up weekly and then later monthly. The last wave of data collection was in March to April 2022. So in total, that's 2 years of follow-up. So in total, there are over 70,000 people taking part in the survey, contributing to over 1.2 million surveys altogether over time. So in addition to the surveys, we also conducted 400 interviews to get a more in-depth understanding of individual experiences. So in one of the survey, we asked our participants why they take part. So an important reason we identified is that people find it relevant or out of personal interest. So we felt it's almost our obligation to share our findings in a timely manner with our participants, especially in this particular context. And some participants commented on that they use our newsletter as a trusted source of information, which they will use to direct their own behavior. And this, to some extent, also help us to maintain a high retention rate over time. That's reduced a number of people who drop out of the survey. So I will pass to my colleague, Alex, to tell you more about what exactly we did to engage our participants.
Thanks, Fei-Fei, and hi, everyone. It's great to be here. So I think really just at the outset, when we were planning the study under these very tricky conditions, it was really important to embed clear plans for communication and dissemination into the funding, into the protocols, into the deliverables, and to really have that plan in place early on rather than thinking about it as an afterthought towards the end of the study. When we launched the study, it was really about building trust in the product, so to speak, so people could see a brand, they could see something and identify it as the COVID social study. And we developed a dedicated website, which had individual researcher details on there, so there was a human face behind this survey as well. We had a lot of media coverage, so we were speaking to radio, television, producing blogs, podcasts, so using different mediums and translating findings throughout so that they were accessible to different people. We also had relationships with community organisations through previous research studies, so we really harnessed their support, both when publicising the study and recruitment, but also when disseminating the findings as well. And one of the core products from this was a monthly newsletter, really launched early on. So I think we started that around the May 2020 time. So people knew what we were doing and were having regular updates. So that monthly newsletter provided plain language feedback, not only on what was being published and what we were finding, but also on the things that we were working on at the moment, as well as the things that we were planning on publishing. So people kind of knew that they were invested in something and they could return to it and know that next month there'd be something else to read about. All of our papers were also published as preprints as soon as they were ready to be submitted to journals. So the results were accessible online before publication in peer-reviewed journals, which can take months. We've had one journal that's been sitting with one paper sitting with a journal for a year. So just to have that information accessible earlier on was really helpful. And another thing was saying thank you to participants regularly. So every month in our newsletter, we thank participants for their ongoing involvement, and we reminded them that this research couldn't be done without them. It just wasn't possible. You know, they were the core of this being a success. We also produced a thank you video, which was released at the end of the first year and again sent directly to participants. And we also told them how the findings had been used in policy as well as with government advisory roles as well. And then in the second year, we also did a seminar which participants were invited to, just to get an update on what had been happening in that final year of the study. And the final thing to say was also just, it's important to measure the impact that the study is having on people in real time. So we encouraged feedback loops so that participants could contact the study team. We had an email address for suggestions, for thoughts, for people to share stories. And we had a dedicated resource that could manage that inbox and try to reply to as many people as possible. We also showcased that feedback in our monthly newsletter in participants' own words. And finally, I think a lot of things that came out of this was that the study made them feel like they were contributing to something useful and helpful because they could see that the findings were being used in policy and government decision making. And it was also a personal thing that was happening. We were all in lockdown for periods of time. So it was a really helpful tool for people to be able to track their own mental health and to sort of work out when they might need extra support and when they might need to reach out and engage in more meaningful activities to support their well-being.
That was brilliant. That was absolutely brilliant.
Thank you.
Alex and Fifi, I hope people at UCL appreciate what they've got in you two. That just sums up to me, it's not about just the findings. It's about thinking about it from the get-go. And you just see that as right. So there are going to be loads of questions, I'm sure. But I'm going to move us on to the next two speakers, which is Vicky N and Amanda Wellings. So thank you for those two. On to the next two. Vicky, are you ready?
I'm ready. I'm waiting for my slides.
I think we're there for you.
Great. Thank you so much for inviting us to talk. I'm Vicky Ennie. I'm manager of the Inhale project. I'll do a brief introduction and then Amanda Wellings, who's part of our PPI panel, will do most of the talking. Next slide, please. So our research is called Inhale. This is a large NIHR funded research program to improve the use of antibiotics through implementing rapid diagnostics and molecular diagnostics for hospital-acquired pneumonia in the ICU setting. We have been going for quite a while, for 7 years, so we've had an integrated program of 5 work packages, and this is very much a pragmatic real-world study. It's led jointly by UCL, UCLH and University of East Anglia, and overall we've involved 15 different ICUs in England. I think one unique challenge about our participant group is that unfortunately, as these individuals are in ICU, many of them do not have capacity, they are unconscious, so a lot of the communication between the care team and the study team happens with the relatives rather than the patients themselves. Our next slide, please. Our PPI has really been integral to the whole research program. We've been really lucky that we received some support from PPI RES, who are a Norfolk organisation, to help support and set up the initial group. We've had 7 members who've supported us throughout. They were first established in 2016. And Amanda is one of those members, and we generally meet quarterly. And during the PPI meetings, the team presents updates from the research, and the PPI panel asks questions, comment on the progress, and we consult them on any major decisions. And one really key part of that is taking their advice on any sort of participant and patient facing communications, such as consent documentations or newsletters that we send them. And also their role is to raise any ethical concerns. And we've worked in various ways to try and raise awareness of our research, both for participants and for the general public. So now I'll hand over to Amanda. Next slide, please.
Hi, I'm Amanda Wellings, and I apologise for the fact that my cat's just bombed the video, but he always does. Yeah, as you can see, we've got pictures. We've had the same PPI members throughout and virtually. And because of that, we managed to really build a good relationship with the PPI group and the researchers over that time. One of the most important things was right at the beginning, myself and a lady called Penny Vickery, who a lot of people in the PPI world know, we actually said that wouldn't it be good to feed back to the participants at the end? And you're talking about 7 years ago, and a lot of people didn't even think about that. So we had that on the consent form. which is very strange, bearing in mind the consent and the PPI information was often going back to relations as well. But we had different ways which they could receive feedback, and some of it was actually written. But as you can see, just by reading the slide, we did absolutely cover everything. There wasn't one bit of that study that the PPI group weren't a part of and giving our critical friend voice to. So next slide, please. So what we did as well was we did a piece of outreach at the end, which was taking part in the Rise of Resistance Festival, which was an online festival all about antimicrobial resistance. We got the grandchildren of the people and children of the people that were on the PPI panel to draw pictures of what they thought antimicrobial resistance was and what the super machines were that we were going to be that we were working with. And this was one of the first poems I actually wrote for a piece of research. So we took the pictures and we took the quotes from people, quotes from the panel, and I wove them all together and did a historical poem about the history of penicillin. So that's actually on YouTube, and that was one of the first poetry things I did. Next slide, please. We also, as part of going out to the public, there was a simple game created that we could take out to explain what antimicrobial stewardship was to the general public and children, and you can see sort of people getting involved with the events when people went out and actually played this game with people to explain something that's quite complex. Antimicrobial stewardship is not something that the everyday person in the street might get, or they definitely wouldn't get what the study was about, because it was quite complex. So all the way through, we've been working out how to make things simple for people, which I think is really important. As well, there was a website that people could go to throughout, and there was newsletters and things given to members of the public that had taken part who said that they wanted it throughout. We're now, I think we're next slide. So I think we've got, yeah. Now we're trying to put together an infographic for the trial results. And we're using the 10 recommendations from the Knowledge Mobilisation Alliance, which is someone who's going to present here. So we've actually used that. We had a PPI group meeting with all the members that you'd seen, and we went through the 10 recommendations for how to report back. And we've used those ideas in how we're going to put the infographic together. Unfortunately, we haven't got the infographic ready for this because it's still with designers. And another barrier we found was with the website. Partway through the 7 years of the project, they changed how they worked the website. And our person who was part of the team that had to do the website didn't have the training to use the new system. So websites can go bad on you over long projects. So that's just the idea that you do need someone who's responsible for website design and for keeping up the things that you report back to the public. Otherwise, they go and view the website and they've just got something that's stale. So a website constantly needs updating and needs new stuff to keep people active. So I think next slide. Yeah, the next slide is just sort of further information, and on it we've got a link to the website. So perhaps in a way it's telling you, it's got information about all the team and whatever, but it perhaps tells you a little bit about how not to do a website, if I dare say that, and be respectful to Vicky and the team. It is one of the big barriers. If you haven't got anyone in comms on your team, how to keep something like a website up and going. And at the end of the project, what do you do to the website? How do you keep the website fresh? So that's a little barrier to use.
Okay, Amanda, I'm gonna
Thanks.
wind you up. That was brilliant. Lovely example of how patient involvement is not one person on a committee. It's multi-layered and multifaceted. Thanks to both you and Vicky for that presentation. I'm now going to move us on. Another 5 minutes with Lynn Laidlaw and Charlotte Sharp, looking at the COVID Voices study. Lynn, are you kicking us off?
No, it's Charlotte.
Charlotte first then. Thanks, Lynn.
Thank you. Thanks very much indeed for inviting Lynn and me to talk. I'm Charlotte Sharp. I'm a clinical academic rheumatologist working in Manchester and the principal investigator on the COVID Voices study, working very equally with Lynn Laidlaw and Joyce Fox, our other patient public contributor. So I'm going to provide a brief overview of our study, and then Lynn will give much more detail exactly about what we did to try to keep our participants involved. So the title of our work was Understanding Personal Shielding Stories, the voice of people living with inflammatory arthritis and autoimmune disease. So a smaller study than we saw from our colleagues' excellent work earlier on, really digging down to try to understand how shielding had affected our particular patient cohort. And the picture that you see here is one of the creative materials that we had submitted by some of our participants, which was one of the ways in which we tried to be as inclusive as possible for this research. Next slide, please. So the study was a qualitative research study. We interviewed 28 people. We held 2 focus groups containing 6 people each. And as mentioned just now, we openly offered for people either to contribute creative materials alone or to do that as well as taking part in interviews and focus groups. And that wasn't something that I had been involved with before, and I was a bit nervous about it, but Lynn and Joyce were particularly keen that we did this to try to be inclusive. And we received really amazing array of photographs of pictures. We saw lots of sculptures. Somebody submitted a video of them playing a song, and we had some very moving written materials as well. So that's really enhanced the study. The work, as I said, was actually thought up by Lynn and Joyce, and the work was co-produced with them, and they were paid as researchers throughout the project, and I supervised that, but we tried to keep it kind of level hierarchy. We had a patient advisory group, which was comprised of 4 individuals who were eligible to participate in the study, and they took part actively in the study design and also the analysis. So they were sent excerpts from our qualitative work, and they were also remunerated according to the involved guidance where they felt able to take that funding. Next slide, please. So why did we want to keep participants informed? Well, as we've heard already, I don't need to rehearse these arguments. I think we're all on board with the idea that it's good practice and there's an ethical imperative to do this. We wanted participants to feel included and informed by sharing our results in future publications. And a lot of what we discussed with them was very emotional. So we felt very privileged that they were willing to share that with us and to give us the opportunity to share their stories. So this was an essential part of the research, and Lynn, I'm sure, will tell you that her previous experience had also coloured her enthusiasm for this work. So we asked people in the original consent whether they would like to be kept informed, and 100% agreed to this. Lynn has kept people involved with email updates throughout, and she will talk to you about the celebration event that we held. And we intend to continue to keep in touch as our formal outputs come out imminently. I'm going to hand over to Lynn. Next slide, please.
Thanks, Charlotte. So we'd always intended to hold a celebration event to share the findings with the people who participated in Voices. And we agreed a date and time that suited as many people as possible. And those who couldn't attend but wished to receive the PowerPoint presentation were sent it by email. And as well as participants, the funder versus arthritis, the patient advisory group, the research team, and staff from the Centre of Epidemiology were represented because they'd all been such a part of our research. We shared a video of the creative materials, as Charlotte has detailed, and people had the opportunity to ask questions and comment. And it was an emotional event, but in a really good way. And also, I think for us, it felt really important to sense check our findings and to say to the participants in our research, did we understand what you told us in a way that has meaning and relevance for you? And that just felt so important. Next slide, please. And it was Charlotte's excellent idea to evaluate the celebration event, and the anonymous questionnaire was completed by 21 out of the 29 participants attending. The things that people said that they liked was meeting the research team and each other. And I think that was particularly poignant for those who had participated in the focus groups, because they told us they had valued meeting other people who had to shield, because a lot of people didn't know other shielders, and having the space to discuss the issues collectively in just what felt like a really safe, supportive environment. And the video of the creative material submitted was particularly emotive. There wasn't a dry eye in the house once that had finished playing. You know, I'm really struggling to articulate the feels and emotions expressed at the event. And the best I can come up with is it felt like a collective hug for everyone involved. And I think this quote sums it up beautifully. And indeed, what we had hoped for all of the research. So it felt both academically rigorous and full of emotions and care. And I don't think they're mutually exclusive. Next slide, please. So we asked people in the survey, what did they think about sharing results with participants? And the quotes speak for themselves here. As a research team, to hear that people felt valued, listened to, and this would encourage them to contribute to future research was wonderful. And people said, so this is just an example, an excellent idea and an integral part of the research process, something that many researchers promise, but very few do. And thank you for running this amazing project. It means the world to have our voices heard. And I'm getting really emotional as I read them again. Next slide, please. So an essential part of how we went about our research has been the importance of reflexive practice, and it felt right to share some reflections here at this event. And we felt that keeping in touch with people was a strength of our project. And our co-produced methodology facilitated this. We were equals. We conducted the research together, and as Charlotte has said, we had a very flat hierarchy. And this meant that I could take responsibility for keeping in touch. And it's the first time, even as a very experienced public contributor, I had the position and power to do so. And we've continued with this approach even after the research has officially ended and we aren't getting paid anymore. And I think this is a crucial issue that needs resolved, as most research is set up in this way. You know, what happens at the end? How can we keep in touch? And we need to acknowledge the time and effort it takes, but also the importance of being transparent in this way. And I understand my bias here due to my experiences of participating in research, not getting any feedback, and how that made me feel. And is there an essential question here? Whose research is it anyway? Who are the most important people to keep updated and share the results with? And I think this is a really fitting quote to end with. It's lovely to see the value of your effort and makes you more likely to take the time to contribute again. Thank you. You're on mute, Jarek.
Well done, Lynn. That's because I coughed earlier on. I think a perfect example of the mutuality, that reciprocity that we all learn from working together. And so do I have any questions from anybody? I don't see one. Charlotte, I would say to you, I'm now thinking I'm going to put after my name, ethical imperative, right? I think that's a lovely example that it's not about doing something extra, it's something that's right and proper. Thank you for that.
We'll give Lynn the credit for that because she wrote that slide, so credit where credit's due.
That's ethical, yeah. Okay, so I'm wondering, Will, so I've got no actual questions, whether we just go into the breakout rooms now.
Yeah, no, that sounds good.
No. Work together to produce some top tips, and these will be based on the insights and feedback that you share. So do you just want to press the button, and then we'll come back here briefly for a break.
Yeah, that's fine. So just very quickly, if I can jump in on the slides in front of you, and this information was shared in the briefing, and it will be posted in the breakout groups when you go over there. So don't feel you need to recall all this now. But there's 2 slides as well. If I can go to the next slide as well, Jacinta. So there's about 9 bits of feedback that we heard through from you all. Basically, everyone was really great in submitting their kind of thoughts, priorities, those ideas around what's most important in feeding back to participants. And we've distilled them down into kind of 9 to 10-ish sort of overarching themes. I won't say any more. I'll send you all into your breakout groups now, and I'll let your facilitators explain the next steps and what we hope to do in this session. So I'm going to send you into your groups now, and you should all receive a little notice that will allow you to join. So here we go. So you do see it pop up in your